I'm Melanie Weatherly and I'm the Chair of Lincolnshire Care Association. So we've introduced a digital observation kit into care homes in Lincolnshire to enable the care workers to take those observations under clinical direction, and they're then digitally transmitted to the clinician who needs to read them and monitor them. This was introduced to delegate the taking of the observations without delegating the decision making. And unlike most other delegations, this is not a case of substituting a clinician with a non-registered member of staff. If this task wasn't delegated, it wouldn't be happening.
I'm Luke McCarthy. I'm Assistant Manager of Ashdean Care Home in Sleaford. Before we had this kit, we'd have to write it all manually on a piece of paper. The risk of writing down observations was that if it did get put down wrong, or if it got missed, then that was that observation not recorded.
We use the kit in two situations. Firstly, if a resident is unwell, before we make a phone call to 111, or in Lincolnshire we're lucky to go straight through to our clinical assessment service, we take the observations. The clinician at the other end of the phone can see them and can work out more easily what they need to do. That's very simple and straightforward. The more useful but complicated time that the kit can be used is as part of managing deterioration in our residents. That might mean that we're taking the blood pressure every day if new medication has been introduced that can affect blood pressure, or it may be taking readings regularly, perhaps monthly. The key things there are that the frequency must be determined by an appropriate clinician as part of the overall support plan.
My name's Claire Burrows and I'm a clinical care coordinator, nurse practitioner, supporting care homes within the locality from a GP surgery perspective. So this is most definitely a delegated task, and the clinician has to remain responsible for that delegation. What we're asking them is to work with us to improve the outcomes for their residents.
You can delegate the taking of the observations, but you cannot and must not and should not delegate the decision making.
Hello, my name's Laura and I'm the Deputy Manager at Ashdean Care Home. We currently use our kit with our residents that have dementia. It helps prevent people going straight into hospital for situations they can dealt with at home and looked after.
So my experience with working previously with telehealth is that most definitely improves collaboration between professionals caring for these people. What it also does is improve health outcomes, because it ensures that we can work collectively to meet the needs of the individual person. And then that in turn then potentially reduces admissions to hospital. I can categorically say that my relationship with the care homes that I support has been improved because of telehealth.
I'm confident with using the kit. The kit itself is very straightforward to use.
My hope for the future is that we continue to use this kit as part of a delegation landscape so that we take the readings that are needed and they're passed on to the appropriate clinician to make decisions around. But my big hope is that we can go beyond the walls of the care homes. We have lots of people living in their own homes who have the same level of frailty, the same need for monitoring, and we need to make that work. It can work, it will work, but it's slightly more complicated. If anyone was thinking of doing this, my message to you would be, if delegation is something you've not done a lot of or you've not done on a system-wide basis, this is a good place to start.